This prenatal supplement is a combination of vitamins and iron, which are essential for the body, especially during pregnancy. It helps to prevent vitamin deficiency caused by a poor diet or certain illnesses. It also provides important building blocks for the body and contributes to maintaining good health. It is recommended to take 1 tablet daily, preferably with a meal to maximize absorption. This supplement is best taken at the same time every day to ensure consistent levels of vitamins and iron in the body. When taking Kosher Prenatal Plus Iron, it's best to take it by mouth, usually once daily as directed. It's important to follow the directions on the product package or as directed by your doctor, and not to take more than the recommended dosage. For optimal effectiveness, it's best to take this medication on an empty stomach, about 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food, but it's important to avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication. If you are taking the delayed release form or extended release capsules, it's important to swallow them whole and not to crush or chew them. Taking the medication regularly at the same time each day will help you get the most benefit from it. Some common side effects of Kosher Prenatal Plus Iron include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, contact your doctor or pharmacist. Iron may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it means that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can report side effects to Health Canada. It's important to keep in mind that accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. Therefore, it's crucial to keep Kosher Prenatal Plus Iron out of reach of children at all times. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. Before taking Kosher Prenatal Plus Iron, it's important to let your doctor or pharmacist know if you are allergic to any of its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you have vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which can result in serious nerve problems. It's important to consult your doctor or pharmacist for details. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication. Additionally, this medication passes into breast milk, so it's essential to consult your doctor before breastfeeding. When taking Kosher Prenatal Plus Iron, it's important to be aware of any potential drug interactions. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of this product. Be sure to consult with your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, it's important to inform your doctor or pharmacist if you take certain anti-seizure drugs, as they may interact with this medication. Additionally, Kosher Prenatal Plus Iron may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors know that you are using this drug. If someone has taken too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. When it comes to the daily dosage of Kosher Prenatal plus iron, it is important to follow the directions provided by your doctor or pharmacist. Typically, this medication is taken once a day with a meal or as directed by your healthcare professional. It is important to take this medication regularly in order to experience its full benefits. If you have any questions or concerns about the optimal timing for taking Kosher Prenatal plus iron, be sure to consult with your healthcare provider. If your doctor has prescribed Kosher Prenatal plus iron, it's important not to share it with others. Be sure to keep all your medical and lab appointments while taking this medication. Some brands of Kosher Prenatal plus iron may also contain ingredients such as docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to remember that Kosher Prenatal plus iron is not a substitute for a proper diet. It's always best to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take a dose of Kosher Prenatal plus iron, take it as soon as you remember. If it's almost time for your next dose, then skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Kosher Prenatal plus iron, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, always follow the proper guidelines for storing and disposing of medications to ensure safety for everyone in the household. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.